everyone. Welcome to the Healthy, Wealthy, and Smart YouTube channel. I'm your host, Dr. Karen Litzy, physical therapist and owner of Karen Litzy Physical Therapy based in New York City. So before we go on, make sure you hit that subscribe button and the little bell button so you don't miss any new episodes, as we're going to be dropping quite a few in the next couple of weeks. Now, in today's episode, we are talking about bridging the gap between technology and patient engagement, which I know doesn't sound like it should go together, but it does. And now technology, as we know, is getting better and better, and it's actually helping our patients engage with our practices. So my guest today to help walk us all through this is Lisa Blue. She is the Chief Clinical Innovation Officer with Providertech and collaborates with her team to develop and implement technology solutions that address the complexity of scaling patient engagement while improving operational efficiencies. Lisa is an RN with clinical experience ranging from acute care to federally qualified healthcare centers, giving her the ability to effectively translate and improve healthcare workflows. She is an enthusiastic population health leader who believes that doing healthcare differently is better. So I want you guys to really enjoy this episode so you can kind of get the big takeaways of how we can use technology to engage our patients, to make our patients feel seen and heard. It can be done. So a big thanks to Lisa for being a great guest this week, and thank you for tuning in each week. Hey, Lisa, welcome to the podcast. I'm happy to have you on today to talk about that intersection between patient engagement and tech, and how tech can actually help patient engagement, which I think is a big misconception that it makes things worse. But we'll talk about all that. I'm happy to have you here, so welcome.
Thank you so much. I'm so glad to be here.
Okay, so when we talk about, well, let's put some definitions to some of these terms, right? So when we talk about patient engagement, how do you define that?
Yeah, I think that's a really important distinction because I think it changes in different settings. Basically, patient engagement in the most simple form is just the patient responding in the way that we expect them to respond. If we're reaching out to them because we want to re-engage them in care, maybe they just had an acute care episode and we want to get them reconnected to primary care, their response is a sign of their engagement. And so based on what we're asking them to do, maybe the call to action is to call us, maybe it's to respond to a text. And so any of those things can meet the criteria for patient engagement.
And then when we're talking about technology, and certainly technology in healthcare, that can really run wild, right? So
Yes.
in your experience, in your day-to-day, when you're speaking about technology, as it relates to patient engagement, what are you talking about there?
Yeah, so you're absolutely right. In healthcare, we all use a lot of different technology, much of which can complicate our days more than help us. And so I think that also really matters when you think about patient engagement. It has to be something that's easy for users, both those of us on the clinical end of the picture, but also for patients. If we're asking patients, anyone to do something, it has to be easy for them to do it, right? And so sometimes, we've all heard of patient portals. The challenge with patient portals is often they can be a bit clunky. They can be hard to log into. I can't remember my password. Once I get in there, maybe there's so much information I don't know, how to even navigate through it. And so it has to be. When you're thinking about it, the most simple solution is usually the best solution to get the information that you desire to get to that patient and allow them to access it easily.
Yeah, and I hear a lot from my patients like, I did get that test back. It's in that portal. But wait, I forgot what my password is. Or then once they're in there, they're like, wait, what do I click on? How do I
Right.
find this result? How come it's not right in the forefront? Like, shouldn't it be first? So I definitely hear that a lot, and that can be very frustrating for a patient. And so as we talk about the frustrations around some technology, could that disengage patients and they could just throw their hands up and say, I'm going to a different doctor?
I absolutely think it can. I had a colleague one time, we were talking about this idea of patient portals. And so there's actually been some interesting data on the uptake of use in patient portals. So obviously during the pandemic, we really needed to use patient portals because we couldn't see our providers face to face. And so I think probably did help with some of that adoption. But even some of the EHRs that have I would say the most savvy patient portals, meaning they have a least of those issues that we were just describing, the adoption rates are still pretty low. And so my colleague and I were talking, and he's a middle-aged man. Technology is not a barrier for him. So there's none of those challenges that maybe we hear. And he talked about getting a message from his primary care provider, and he had a history of skin cancer. And so he had something that was removed, and, he was like trying to check in and see, what were the findings on that pathology report. And so then he couldn't remember his password, and then he had to reset the password, and then it went into spam, and then he could, and so now like he's calling the office and he's getting more and more anxious. And so an hour now, transpires. And what the actual message was like some general, like, it's time to get your flu vaccine or something. While probably important, it wasn't what he was anticipating it. And so he was so frustrated by that experience. And I think that's just a real life illustration of what patients often face, right? When using tools like that. And so certainly when you have that, that anticipation of what you think it's going to be and it's not, or it's hard to navigate, you could further remove yourself from wanting to engage or use tools like that in the future.
Right. And so that's definitely a challenge of technology and its use in healthcare. So what other challenges have you seen? And then of course we'll save like the thumbs up, the great parts about technology after that. But let's talk about challenges first. So I think that's a big challenge from the patient side. What other challenges have you seen?
I think there's macro level challenges and micro level challenges. I think some of the macro level challenges is the lack of interoperability, right? It's shocking in 2023 that it can be hard to find information on a patient that you're caring for. If they just had a test, they were just in the hospital, they had lab work, you want to look at what medications are on, any number of things that could impact your decision making, your clinical decision making, how difficult it is to find that information. Even in some states, and some states or organizations do it better with something that's like a health information exchange. But even that can, again, just like we were talking about portals, be hard to navigate. And so I think that is really a macro level challenge, how all of this information exists for patients and it can still be hard for those that are caring for them to access. And so I think that's something that really, as clinicians and healthcare leaders, we all need to speak about that and be responsible for making that better, however, whether it's within our own organizations or if it's at a policy level. But I think that's really, really important. And then, when I think of some of the challenges at the more micro level, or maybe things we've experienced, it's just the challenge of working with multiple systems in a day, right? You have your electronic health record, and maybe you have different things you interface with. Maybe you're logging on to like an individual lab results thing. You want to check on your patients. And so, multiply that all day long for each patient. I think that gets very overwhelming. And when you think of the challenge for providers, I think there can be even more fatigue in what that looks like at the end of our day. Right now, we spend all day with our head in a computer instead of taking care of the patients that are there in front of us.
Right. Yeah, absolutely. And as the patient, and you're going to see the practitioner and they're just typing away on their computer and looking at you for a second and typing away, that again doesn't really help with the engagement part.
Right.
Right. Because you feel like,
exactly right.
Is this person hearing me?
Right. Are they engaged? Right.
Are they engaged? Exactly. So it's not just patient engagement. It's so true. It's also the practitioner engagement. It's a two-way street. And if one person feels left out, let's say, it doesn't make for that good therapeutic connection and alliance, and moving forward can be quite challenging and difficult.
Right. I think one other thing that is important to mention is, technology can intimidate people, even in the healthcare system. And so what I've seen in my own, before I worked in healthcare IT myself, when I was still in a clinical role, there was office this misconception on like what is HIPAA and what is HIPAA compliant and what is not. And I worked with the technology leader, and sort of his go-to was, well, we can't do that because of HIPAA. And you hear that in healthcare, and certainly being safe and secure and in compliance, very important. But I've also seen even people at decision-making levels using that as sort of the answer to things. And so again, I think it's important to then say, well, what about that is not in compliance with HIPAA? Because I think that it is. Could you help me understand? And so I think that is important too, because while security matters, and you certainly always want to be cognizant of protecting patients' information, we also want to make sure we don't go so far that they can't access their information, they can't access their providers, right? And so I think finding that sweet spot between the security and compliance and accessibility is really, really important.
Yeah, absolutely. So there are some challenges, like you said, macro, micro, down to individual tech proficiency, right?
Yeah.
It's especially if you're used to the old pen and paper writing charts. When I first started as a physical therapist in a hospital, we were writing with
Yeah.
written charts, which also had its challenges if you didn't understand how people wrote.
Yes. Right.
Sometimes people's penmanship was terrible. So
Often.
often. So on that note, let's talk about the opportunities in implementing technology and how perhaps it could transform a healthcare practice.
Yeah. When you think of the example that you just said, having to document by hand for each patient, for each interaction, for each encounter, same when I was a nurse starting out, and writing my initials in a million boxes throughout a shift, right? And so, while electronic health records have their own challenges, they're certainly, by and large, if you compare them to paper charting, much quicker, much more efficient, and in terms of what information we can get out of there, right? If you, back in the day, if you did a chart audit, you had to do a chart audit. You had to take said chart and read through the entire chart. Where now, we can amass that data and really tell a much more compelling picture if you're looking at a patient population that you're caring for, right? How many patients in the last year were patients that had this chronic condition, and how controlled were they, and how many visits did they have? And it gives us a lot of information. When you think about like predictive analytics, even at that baseline, you can start to tell a picture of, this is how controlled this population is, and this seems to be the right amount of engagements, whether that's an in-person visit, and going back to patient engagement, how else to leverage the resources that you have on your team to support them when they're not in the office. And so being able to have all of that data in a way that we can export it and process it and look at it across a practice or panel, however we want to look at it, is really very exciting.
Yeah, the data can definitely show the health of your practice, especially if you're a private practice. Right? Because, sometimes we think, I'm so busy. And you're like, oh, wait a second. Right. So it can kind of show the health of your practice from a financial standpoint. And like you said, it can also show, are we overutilizing visits? Right? Is this person, or here's this diagnosis, this is the average number of times our patients are being seen for that. And what does that mean? Right? How can we improve our practice from a financial standpoint, improve our practice from a patient satisfaction standpoint? And again, going back to the engagement, how can we improve all of that? And it's hard to improve things if you don't have the data to begin with.
Absolutely. Right. You're making a lot of generalizations and assumptions without that data. I
Yeah.
think the other thing when you think of patient engagement, one thing that whenever we're talking to different practices that are, anything larger than one provider,
Mm-hmm.
is, really understanding the different ways your organization might be interacting with that patient. And so the larger the organization, the trickier that becomes. And, going back to patient experience, if I have somebody from 4 different areas of the practice trying to reach out to me, to whether it's phone or text or email or all of the above sometimes,
Mm-hmm.
that has, as you can imagine, a profoundly negative impact on the patient experience. And so that is also something to think about, when you're saying like, what does successful patient engagement look like? The frequency of that engagement and the overall number of times you attempt to engage is really important in that equation.
Yeah. And are there norms for patient engagement? Are there normative values?
Yeah, you know what? It's really not normalized across healthcare as a whole. What we do know is that there are certain patient populations. It's pretty obvious to say that different populations require different frequencies or different intensity of
Mm-hmm.
engagement. So if we're working with someone with multiple comorbidities and they've had several admissions over the last year, and maybe based on their payer type, they might be someone that requires a little bit more intensive support.
Mm-hmm.
Versus someone who has been pretty consistent in their self-care and their preventative screenings or things like that. And so those are all things that factor into what is that rate equation when we're making those recommendations.
Yeah, that makes a lot of sense. So, like everything else in healthcare, it depends.
Yes, exactly right.
It depends. Okay, so, you've consulted with many different practices and you have helped practices kind of transform how they do things, right? So, what are your top strategies if there are any uh healthcare providers listening, any healthcare practice owners listening, what strategies can you share with them in order to kind of transform their practice through technology to improve their patient interactions?
Yeah, that's a really important thing. And whenever we're working with a new practice, this is where we start. This is really our foundational approach. And it's something that I encourage every practice to start there. Sometimes maybe we get a little ahead of ourselves. We get excited if we maybe see a value that isn't where we want, and we're gonna call all those patients right now, right? And stopping a little bit and just making a plan from this foundational place is really key to success and successful engagement. And so there's 3 key steps. The first is navigation. And so I always talk about the healthcare system is hard for us to navigate, and this is our business. And so when we talk about patients that maybe have language barriers, or the healthcare system, you hear certainly a lot about health literacy, it can be confusing and overwhelming. And so being very clear on the navigation is important. And so what I mean by that in this case is if I'm outreaching to somebody, a patient, if I'm building a program, we're very clear in what is the next thing we're asking them to do and how to do it. So for example, if we're asking them to come in for a cancer screening, for example, we're saying, here's what to do to schedule that. Respond via text and we can help get scheduled. Call this number, click on this link to schedule. So being very direct and clear, here's how to do what I'm asking you to do. So how to navigate them to that is really step 1. Step 2 is education. In healthcare, we give so much education. We know certainly our patients can Google things, they can find a lot of information. What is the quality of that source? It can be tricky.
Dr. Google can sometimes be wrong.
Right. I mean, it does happen. And so I think in this case, being very intentional about the volume of information we're providing. So when I was still in a clinical role, I used to work in a procedural area, and these patients had conscious sedation. And now, granted, we're sending them home with their families, but we gave them an entire folder of information on how to care for their arterial site, how to, manage their cardiac risk factors, and this whole bit of information. And I look back on it now, and I think, what a missed opportunity, because we're sending them home with this whole novella of information, right? Instead of saying, here's what you need to do in the next 24, 48 hours. That's an acute period, right? You just had this procedure. And so whenever you're thinking about outreach, you need to think about what is that one or two most important things to the patient. Not it's time to come in for this screening or for your chronic care, but why does this matter to you, right? And even if someone is, maybe it's a screening and they don't have any symptoms, that's a great opportunity to say, well, you might not have symptoms in early stages. That's why it's so important that we can get you screened today. That's why we're reaching out to you. So being very succinct about education, and that it should be something that's very consumable for the recipient. And so being mindful of health literacy and reading levels when you're developing that. And then the third is behavioral economics. And so behavioral economics is such a really fun and interesting segment of psychology, but really it's just looking at why a person does something or not. And so by building the behavioral economics into that foundation, you're thinking about the specifics of a population and what are some barriers they might be encountering. So we work with a lot of federally qualified health centers who serve really complex patient populations often, right? It can be a very high Medicaid populations. Maybe they have a lot of different barriers to even accessing care. And so knowing those are some of the known barriers or challenges that they're facing day to day, then how can we proactively know that that's potentially a barrier, and then build that into the messaging. And so knowing the population, knowing the audience is really important, as well as that navigation and very succinct education.
Yeah. And so to recap, navigation, education, behavioral economics.
Correct.
You want to look at all of those as strategies. And how can technology play a role there, right? So talk a little bit about the solutions that Providertech, and we'll get into Providertech. Well, let's get into it now. So what does Providertech do to help with those strategies?
Yeah, so we are a healthcare technology company, and we use technology to scale communication. And that's, I'm making that distinction on purpose. So we don't use technology to solve the problem. We work with our clients to understand what is the problem that they want to solve. And we use some of the foundational strategy that I just described. And then we use technology only to scale that. So we're very clear to help them define the problem, define the priorities and the objectives. And we do that by having people that have worked in healthcare. And so we have people that have clinical backgrounds, both in acute care and ambulatory care, really have experience working in public health. So understanding different populations and what are those challenges that some of those unique populations might face. So our secret sauce is the people that's part of our team. And then we use technology to really scale that across a population.
And what does that look like from a tech standpoint? So let's say I'm coming to you, I'm a practice owner, and I need help to scale my communication. Right now, I just send out an email every once in a while just to check in, right? So that's what I'm doing right now. But I want to keep my patients engaged so that they know that they can come back to me if they have a problem. I'm top of mind. They can refer me, all the fun stuff that we want our patients to do, and we want our patients to feel heard and cared for, right? So if I come to you, this is my case study. What is Providertech? What can they do for me?
So what we're going to do is we're going to work with you to pull from your electronic health record a segment of your population, and we're going to give you ideas on how to best define that. And so the more specific you can be with that population, the more specific you can be with the messaging, and thus more likely engagement, right? If you send something to all patients that you've seen in the last 3 years, that's a pretty general message.
Mm-hmm.
So we might say, let's build a segment of your population that you've seen in the last 12 months, 18 months, 24 months, depending on the type of practice. And then we're going to target specific groups of patients. So it might be in your scenario, it might be patients that came to you that had a recent injury, or you might even say a certain type of, right? Maybe they had shoulder pain. I don't know,
Sure.
something like that. And now you're reaching out to them, and maybe you're giving them something. You might be saying like, checking back in. I want to remind you that these are really great exercises for you to do. And obviously, it's going to be very patient to patient, but you might send something general. And just remember that when we whenever you have questions, you can reach back out to us. But being specific about the audience is the best way to get engagement. If you send something out and it just says, "So call us if you need something," they're like, "Oh, well, what might I need?" Whereas if you say, "Hey, remember continuing these exercises are going to be really important to your success." "Oh yeah, we did talk about that. I did feel better when I was doing those." So it's little things like that help patients be reminded of a practice. And then the other piece is, how easily can they reach you? And so making it really easy for those patients to reconnect to somebody on your team is another really important piece. If they have to call into a large practice and they're sitting in a long call queue, they're most likely going to disconnect. And so thinking about even the timing of those messages, most practices are busiest on a Monday, right? So you're not going to send those messages out on a Monday because you don't want them to be in that call queue, right? When is a time where maybe the call volume is a little bit more manageable, and you might time the messages around that.
Got it. And so Providertech sends out these messages, or
Correct.
yeah.
Yep. So we
Cool.
send them out on our client's behalf. It looks like it's coming from the client, so they would recognize their provider's name or the practice name. If there is something, generally the message is just that, a message. Sometimes if it's something that requires a bit more information, there are some regulations around the length of messaging. It's governed by the TCPA, or Telephone Consumer Protection Act. I won't go really into it because it's pretty dry, but it governs the length and the frequency of messaging. And so if there's something that perhaps you need to send out instructions before or after a procedure, that is going to be more than 160 characters, right? In which case you might embed a link into that message and letting patients know they can access it by clicking on that link.
Yeah, that makes sense. So it sounds like you can make technology a little bit more personal.
You absolutely can. You absolutely can.
Yeah. And I think that's really important. Now, what, like I said, you've worked with a lot of different practices, right? Have you seen any commonalities with practices and their sort of lack of implementation of technology and of tech tools, and what the reason might be for not implementing them? Because I'm sure there's people listening who are like, well, I can't do this. But maybe if you have seen some commonalities and practices, people won't feel so alone, and they'll be more likely to engage in the tech.
Yeah, absolutely. We see it all the time. Oftentimes, a really common thing we hear is electronic health records, the EHR that they have. They say, "Oh, it's fine. Our EHR does that," right? We can do that directly from our EHR. And while EHRs certainly do have a wide array of functionality, this is the area of specialty that we work in. So we have a lot more depth and breadth in what we can provide. We also have a lot more flexibility, right? We can make those recommendations to, just like the example I just gave. You might want to send that out on a Tuesday afternoon and a Thursday morning based on your call volume. And we have not only the knowledge to provide that guidance, but also the tools to set that up, so they are running in the way that makes the most sense for your practice. And so I think it's important for people to know that, yes, while they should explore what their electronic health record can offer, if they feel like it's not working, that's a really common experience. And they might need something that is a little bit more targeted towards whatever that objective is, in this case, patient engagement.
Right, right. Yeah, that makes a lot of sense. And I'm sure a lot of people are thinking that. What do you say to the practice or the healthcare facility that says, I can't deal with one more piece of technology, right? I'm sure that's got to be a common theme, right? So how do you
Absolutely.
respond to that?
Yeah, I'm laughing not because I think it's funny, but because having been in a healthcare setting, I understand that feeling of I literally can't just take on one more thing. And so that is also part of our solution. And so oftentimes people come to us because they need help with patient engagement. But even just the idea of, how do I set this up? How do I build the population? How do I decide what's the right messaging, the right frequency, and on and on? So our solution is comprehensive enough that we've already built a lot of that out for our clients. And so, for example, we have a message library that our users can go in and say, show me all the messages that I might send to my diabetic patients. Filter that by Medicare payer type. And they're going to find the messages that are most targeted towards those audiences. They can then say, this message is great. I want to use it exactly as is. Or, you know what? I know my patient population and I'd like to make some edits. It's always easier to start with a template and edit it than it is to create it. And so we build a lot of things like that into our solution itself to make it easier, because we understand that we came from healthcare too, and we know day to day how that can wear you down. And so we work to make not only that implementation, but then ongoing as easy as possible.
Yeah, that's fabulous. I love a good template.
Right? Who doesn't?
I love it. I love a good template. If I can copy paste and tweak a little bit, I could not
Exactly.
be happier. I love it. Now that's a great offering, because the last thing you want to think about at the end of the day is like, what am I going to put in this email? Right?
Right.
Ah, my
Exactly.
brain is already full.
Right. And then when you start thinking about the regulations about, how long the message can be, well, how do I fit all of this into 160 characters, or do I have any other options? And so we oftentimes when we're working with a practice, we'll have like their marketing team, they'll come up with great ideas. They sound great, but I'm like, well, that's like actually 4 times as long as it's allowed to be. So we're going to give you some recommendations. And they're like,
Right.
oh, okay. Right. Right. Because they weren't as familiar with TCPA and how to navigate that.
Right. So you've got the rules, you've got the laws, you're sticking to it and educating practices on that as well, which is
Yes.
great.
Yes.
Now, as we start to wrap things up, can you discuss some maybe new trends or technologies that could impact patient engagement, public health initiatives moving forward? What are you seeing?
Yeah, I think the things that are worth mentioning are some of the things that I've already touched on a little bit, but I'll bring them back here and maybe provide some examples of what that looks like.
Perfect.
It goes back to making it very easy for people to do whatever we're asking them to do. So we have worked with Maricopa County. So we're based in the Phoenix area. Maricopa County is I think the largest county in Arizona. And we have worked with our county health department to engage populations that had questions about the COVID vaccine. And they maybe didn't have access to direct information, or maybe they had access to misinformation. And so what we did is we used technology to do outreach to them. And because around the time we launched the project, it was about 2.5 years ago, it was, as you maybe remember, a very heated time. Most people had very strong feelings one way or another. And so we used the technology in a way to, these were patients that were already established at the practices that were part of this project. And so we used this technology to outreach to them about other things. So it's time to come back in for this wellness visit. It's time to come back in for this chronic disease care. And once that patient was engaged, then their teams used our technology to say, oh, it seems like you haven't completed your vaccine series. I can help you get scheduled for that as well. And so patients, some said, okay, and they were able to schedule them. Some said, no, I'm not ready, or I have more questions. And we're able to use some of those templated tools that I've already referenced to say, oh, no problem. You know what, here's some information, you can review this. And so it was easy for patients to access that. And then if they said, I have more questions, they could reach back out, via that direct thread. And so I think that's really important when you think about how hard it is to get to the right person in healthcare. So we made it we took that out as a barrier. We also, if they changed their mind, or, they needed more information, they could at any time say, I'm ready to schedule now. Patients were so happy to be able to have that trusted source, because it was already their provider organization, to be that source of information and answer any questions they had, but also to make it easy to schedule. Quite simply, sitting on hold and waiting for an appointment might be what talks you out of following through with that. And maybe you plan to call back the next day, but do you or do you not? So I think whether you're talking about a project like that, you're talking about value-based care, you're talking about really, anything where patient engagement is step one, making it easy for patients to access it that has to be part of the strategy.
Yeah, absolutely. All right. Now, if people want to find out more about Providertech, where can they find out more information?
Yes, absolutely. So they can email me directly. And my email is just my name, lisa.blue@providertech.com. You can also find me on LinkedIn, Lisa Blue, and that has certainly they can connect with me directly, and it would link right back to Providertech. I have information about our team and some of our projects right on my LinkedIn profile.
Excellent. And we'll have direct links to that in the show notes. So whatever podcast platform you are listening to, or if you're watching us on YouTube right now, you can go to the show notes and one click, see, we make it easy. One click will take you to all of those resources. So what are the big takeaways that you want our listeners to remember from our conversation?
I think remembering that the most simple way to do something, whether, and that's for everybody involved, not just for the patient. We can't be asking our providers and their teams to be doing something that's really complicated. And also, if we're decision makers in an organization, we can't expect that if we have a clunky patient portal or something like that, that patients are going to engage with it. And so I think, remembering that this can be overwhelming for both the patients and the users, and sort of doing that simplicity test whenever you're looking at something. A potential solution, whether it's part of your HR or something else. I think the other thing that's really important in terms of takeaways is to, if you're working as part of a quality improvement team, and maybe you are looking for vendors, it's really important to ask a lot of questions about how do they, not only the implementation, certainly that's important, but how do they work with you and partner with you ongoing? I always talk about, we've all seen this very, sexy demo that we're like, oh, that looks fantastic. I would love to have that. And then you get it and it doesn't even look familiar. You're like, wait, what? Is this what we saw? I don't remember it being like this. And so, that model of support ongoing is really important. It doesn't always exist in technology companies. I think a lot are getting smarter, but I think that's an important question to ask when you're looking for a partner in this work.
Great. Excellent takeaways. Well, I thank you so much, Lisa. And I have one more question. And it's one that I ask everyone that comes on to the podcast. And that's knowing where you are now in your life and in your career, what advice would you give to your 20-year-old self? So I
Hmm.
would think you're in nursing school, maybe you
Yeah.
just graduated. I don't want to make any, so you could have gone to nursing school at 15. I don't know. Um, but what advice would you give to that younger self?
I think I would be open to what is possible. I think a lot of times our younger selves or even our older selves make sweeping declarations about what
Mhm.
we're never going to do. And that is often, you find yourself eating those words. I talked,
Yep.
my younger self said things like, oh, I'll never be in management. I'll never be a teacher. And I've done all of those things. And so I think just being open to where you are right now and knowing that you can't even anticipate what's to come, and being open to the ride is probably the advice I'd give to my young self.
Excellent, excellent advice. Well, Lisa, thank you so much. And just if people want more information on Providertech, you can go to providertech.com. Lisa generously gave us her email, lisa.blue@providertech.com. And again, we'll have all the links from today's program in the show notes on whatever it is you are watching or listening to on any platform. They're there. So, Lisa, thank you so much for your time. I appreciate it. Thanks for coming on the podcast.
Thanks so much for having me. It was great to speak with you.
And everyone, thanks for listening. Have a great couple of days and stay healthy, wealthy, and smart.